begin with Glenna Milberg and the Moderna timeline. Glenna.
Ginny's, Florida's vaccine supply is about to get a lot bigger, and you know the priority people getting it are people who live in long-term care, elderly residents like this small one, of course the big ones, more than 1,000 around the state, and all of the healthcare workers on the front lines. But what happens after that is still up for a bit of debate.
Our whole strategy around COVID has always recognized the dramatic discrepancy in risk based on age.
The elderly in long-term care and those on the medical front lines will continue to be the front of the line as Florida receives its first Moderna vaccine shipments.
There's been some great analysis done to show that if you vaccinate the bulk of the 70-plus population, the mortality on this goes really, really down.
Incoming today, 61,000 Moderna doses. Tomorrow, 300,000 more, plus another Pfizer shipment of 120,000 doses, all for that priority population. As the CDC hears a panel recommendation that the next on the priority list should be professions like firefighters, teachers, and retail workers.
The cafeteria workers, the grocery stores out there, anybody who comes in contact with common population.
The problem with that is, as I see it, is a 22-year-old food service worker would get a vaccine over a 74-year-old grandmother. I don't think that that's an appropriate calculation of the relative risk there.
The governor plans to stay the course he has since the beginning, protect elderly and vulnerable before the younger and healthy, even if CDC recommendations say otherwise. What's the protocol if the CDC ends up taking the recommendations of that panel?
Purely advisory, and they say that. They say states need to be able to make their own decision.
You know, Florida has one of the most senior populations in the country, and of course that demographic has the highest COVID mortality rates, and so the governor feels that he is well justified in the plan to put them ahead of the line. All of that he expects to put out more formally, more publicly tomorrow. I'm Glenna Milberg, live in Miami tonight, Local 10 News.
And Glenna, did the governor say anything about getting a shot himself?
He actually did, Calvin. He was asked, are you going to get one? You know, some members of Congress, young, under senior age, have jumped the line. They have the opportunity to do so. The governor, you would say, is putting his money where his mouth is. He said he will not be getting a vaccine anytime soon. He's in his 40s. He says he's healthy. He will be getting one, just not before the people he is putting as a priority.
Okay, not trying to go to the front of the line. Glenna, thanks a lot.